I now recognize Ms. Tokuda from Hawaii for 5 minutes of questions.
Thank you, Mr. Chair. As we develop policies to better prepare us in the future, it is crucial that we do so without fanning the flames of anti-AAPI extremism that festered during the pandemic. Anti-Asian rhetoric espoused by those at the very top of the Republican Party in the pandemic's earliest days have had very real-world consequences on our AAPI community here in the United States. In an effort to deflect from his administration's botched pandemic response, President Trump looked for a scapegoat and a way to score points with his base. And in doing so, he recklessly villainized AAPI people for his political gain, making our community human shields and red herrings to distract from his inability to deal on all levels with the public health crisis, including understanding in the very earliest days the origins of COVID. For example, within a matter of days, President Trump using the phrase Chinese virus on Twitter, anti-Asian rhetoric on the platform grew exponentially, according to a study conducted by the University of California, San Francisco. And in the summer of 2020, President Trump began referring to COVID-19 as Kung Flu at campaign rallies across the country, ratcheting up vitriol among his right-wing base. This hateful rhetoric online has had deadly consequences. According to the Center for the Study of Hate and Extremism, hate crimes targeting members of our AAPI community increased by 339% from 2020 to 2021. Words, my friend, matter. We know that the CCP did not cooperate with international efforts to understand the origins of COVID-19, but President Trump made it worse. His words help perpetuate the CCP's misinformation campaign and assign blame for the COVID-19 pandemic on Asian American communities, and in doing so further hindered our nation's ability to implement an effective, evidence-based public health response. We must recognize the consequences of our words, the impact they have on the communities we serve, and how it shapes the national conversation on issues of critical importance to our health and our security. Dr. Lowenthal, you've warned about the dangers of politicizing intelligence and national security. As we seek to engage in a thorough, fact-based analysis, what are the real-world consequences of distracting rhetoric and politicizing intelligence regarding the virus's origins?
Well, as I said, it makes it very difficult for analysts to do their work. Because if they know that what they're writing or what they're briefing is going to be questioned not because somebody disagrees with the substance, but disagrees with why they're being told something, it makes it increasingly difficult for analysts to do good work because they are worried about the consequences. Nobody wants to be vilified, either as an ethnic group or professionally, and so that becomes a problem.
Thank you, Dr. Lowenthal. There are clearly troubling consequences, as you noted, of this rhetoric, both for the value and ability for us to do the work, as well as for our AAPI community here in the United States, as well as we've all talked about today, our intelligence community's efforts. How can we make sure we course correct what has been happening to both ensure the safety of our communities and preserve the integrity of our intelligence work as we seek to fully understand the origins of COVID?
Well, the issue of vilifying communities is beyond the scope of the intelligence community. That's not our responsibility. That's a leadership issue. That's a political leadership issue. In terms of the partisanship, I mean, you have to hope that people on both sides of the aisle recognize that analysts are not out there trying to grind an axe. They're trying to present the best intelligence they have at the time with caveats and with uncertainties, and that they're doing this not because they're being pusillanimous, but because they really don't know the answer. And I've had to deal with senior officials many times, and I know this is frustrating, that you want an answer, and sometimes we just can't give you an answer. And that creates a tension between these two communities, between the policy community and the intelligence community. But that is the reality of a lot of the issues on which we work.
Thank you, Dr. Lowenthal. It is my definite hope through these discussions that we're having that we can put the harmful rhetoric aside that we have seen and focus on the work that matters, protecting our nation's public health and preparing for future public health crises. We can be tough on the CCP and their lack of transparency and cooperation with pandemic-related investigations, but we must do so without putting at risk the safety and well-being of Asian Americans and our communities. If we fail to do this, we are only strengthening the CCP's efforts to distract and to mislead, and gets us no closer to fully understanding the origins of COVID and allowing us to do the good work of preventing future crises and being able to respond to save lives. Thank you, Mr. Chair. I yield back.